Okay, go ahead.
So, welcome and thank you for joining us today for the meeting of the New York City Health and Hospitals Capital Committee. Today's meeting is officially called to order. I would like to propose a motion to adopt the minutes of the Capital Committee meeting held on March 13th, 2023. Let me poll each member individually. Dr. Katz?
Yes.
Sarina Espinero?
Yes.
Pagan, yes. Motion adopted. Next on the agenda will be the 3, 4, 5, the fifth resolution. So,
Thank you. All right, well, thank you. Jose, would you like me to read this or did you want to read
yes,
it?
please.
Okay. So this resolution be authorizing New York City Health and Hospitals Corporation, the system, to enter into a contract with Nalco Company,
No, I'm sorry. It's
also an important one, but can't speak as well to this one.
we'll get there.
There we go. Okay, thank you. So authorizing the New York City Health and Hospitals Corporation, the system, to execute a 5-year renewal license agreement with Williamsburg Housing Preservation LP, the licensor, for use and occupancy of approximately 1,742 rentable square feet of space located on the first floor of 333 Roebling Street, Brooklyn, the licensed premises. To operate a pediatric primary care and women's health clinic, the clinic, managed by New York City Health and Hospitals Gotham Health, at an annual occupancy fee of $6,347 or $3.64 per rentable square foot or feet, which will increase by 3% per year to reach $4.10 per rentable square foot over the term, for a total occupancy fee over the 5-year term of $33,695, with each party having the right to terminate on 30 days notice without cost. So we'll go to the next slide. So what I wanted to do for this presentation is start off by giving the lay of the land of our current Gotham Health facilities in Brooklyn, then drill down into the data that we know about the areas surrounding the current clinic that we have, and then talk about the details of the clinic and why it's important to us. So currently in Brooklyn, we have Gotham Health has 50 locations citywide, 13 of which are in Brooklyn, which you can see on the map here. I'll go to the next slide. So our Jonathan Williams Clinic, the clinic we're discussing today at 333 Roebling Street, is a pediatric and women's health clinic. It's a clinic that you can see on the facade here. We've actually put a fair amount of work into over the last several years to have it be more of an inviting facade on the outside and more of an inviting experience on the inside. So it's co-located within a major affordable housing campus off the Williamsburg Bridge. We call this our Jonathan Williams Clinic, and it's occupied the first floor of the Williams Plaza housing campus for over 20 years. In 2022, we had 2,313 patient visits across this 1,742 square foot space. Next slide, please. So to say a little bit more about the population that we're seeing there, and then I'm going to go into some of the data about the community itself. You can see here, interestingly, over time, these things always shift. But the bulk of our patients are from the Hasidic Jewish community. The rest you can see here are we label by the blue is Hispanic Latinos, the yellow is African American Caribbean, and the green is Asian or other. Next slide, please. So to talk a little bit about using the DOHMH 2018 Community Health Profile, what we know about this community as is important to the services that this clinic provides. I'll first talk about birth outcomes, and then I'll talk about childhood obesity and children's healthcare on the next slide. So in terms of birth outcomes, the prenatal care and birth outcomes in this community are actually better than New York City and then in Brooklyn. You can see here that the Greenpoint Williamsburg community has a late or no prenatal care rate of 2.6%, whereas it's 6.7% in New York City. So this community is doing better from that perspective. And then in terms of outcomes, you see this community is also, as you'd expect, doing better as well at 5.4%. For us in Gotham, this underlines the importance of having this clinic continue to provide these important services that it has for the past 20 years, because this is going well for the community. Next slide, please. Where we have more work to do in this community is around childhood issues, in particular childhood obesity. So you can see here that in this community, there's a 23% rate of childhood obesity, which is higher than in Brooklyn and higher than in the rest of New York City. So this clinic, again, is a trusted infrastructure that's existed for a long time that a lot of children have gone to, that we've put work into and we've built out, and we want to continue to offer this capacity to see more children in the future because we know there's a need. We know there's higher rates of things like childhood obesity. So we see in this slide here why the clinic is important to continue because we still have important work cut out for us. Next slide, please. So in terms of details about the clinic, the term here would be for 5 years. The base rent would initially be $3.64 per square foot with a 3% escalation each year. This brings a total, when you add in electricity and water cost over a 5-year period, all in, of $55,164. So compared to some of our other sites, of course, the cost here for the sites all in is substantially lower than what we pay for most, if not all, of our other sites. Next slide, please. Here's the request again, and happy to answer any questions, and thank you for the opportunity to come today.
Quick question.
Yes.
I know that you have to go. So is it our plan, or is it possible, it may not be possible, to develop more of these mini clinics, which are so incredibly productive in such tiny amounts of space? And I know we have large clinics that we're developing, but is it just that these are, it's not as often that you can find something that lends itself to this kind of usage?
Yeah, it's a good question. It's been interesting since, over the last 5 years, where we've really looked at where patients want to receive care. And we have seen, as you're alluding to here, that many patients do want to get all of their care offered for themselves and their families in one place. So that means a place that offers pediatric adult care, but also imaging. You can get your mammogram the same day. Things like pharmacy services, other radiology services, dental services, mental health services. So that's how we've designed our new sites, really.
Going one step back.
Yeah.
Which is like here, you've got pediatric needs in this clinic, which are compelling. So I'm wondering if you can narrow the band even further, because obviously everyone would like everything in their community. But I'm wondering if, given a specific need in a community, whether you have even smaller clinics.
Well, that's actually, what you're saying is a good example of what's happened here. So over time, we didn't initially have the level of obstetrics care at the site that we do now. So as the community has shifted over time, and I showed you the demographics of the clinic, which you can see the shift in the community in that slide, if you want to go back to the slide that shows with the pie chart. But we've grown our obstetrics care in concert with Woodhull based on the shifting of the community, and that's brought more people in to receive care at this site with that sort of focused need that we were hearing from the community. So it's to your point around, we didn't just sort of randomly choose a type of service and place it here. We heard from the community. We saw where there was a gap. We built out that gap. And you can see here, I consider this success that we're meeting the community where they are because they're coming.
Thank you.
Okay. Any questions?
No.
Okay, hearing none, then let me ask for a vote. Dr. Katz?
Yes.
Sally Hernandez Piñero?
Yes.
Jose Pagan, yes. Thank you so much.
Thank you.
Great work. So let's move to the next one. Oscar, and it will be the first one of the action items. Oscar.
No. Every table is.
Consigli, yeah. Solution, Oscar.
Okay, good morning. This resolution is for Consigli. This is authorizing New York City Health and Hospitals Corporation to increase the funding of its contract with Consigli Construction to serve construction management / builder under guaranteed maximum price structure for the construction and construction management services of Correctional Health OTXHU initiation at New York City Health and Hospitals Bellevue from $140,339,695, inclusive of a 10% contingency approved by the board in May 2022 to $159,969,414 by adding $19,629,719 for additional construction and construction management services resulting from design changes.
Is there only one presentation? Do you want to read the other two resolutions?
Yes.
Do you want to?
I'll read the other two.
It's the second one.
Yes.
Authorizing New York City Health and Hospitals Corporation, the system, to increase the funding for its agreement with ACOM to provide program management services at New York City Health and Hospitals Bellevue and New York City Health and Hospitals Woodhall in connection with the system correctional health services initiative to treat its patients who require higher levels of care in the outposted therapeutic housing units in Bellevue and Woodhall. Such the funding is increased from $15,136,567 to $16,635,305 to cover program management costs at Bellevue only. And the final resolution is for Array, authorizing New York City Health and Hospitals Corporation to further increase funding by $1,960,238 for its previously executed contract with Array Architects for architectural/engineering services for the renovation of space at New York City Health and Hospitals Bellevue and New York City Health and Hospitals Woodhall in connection with the Correctional Health Services Initiative to treat its patients who require higher levels of care in its outposted therapeutic units, which follows previous rate of $50 a square foot to $50 a square foot or $20,000 per to increase 2% per year for the total contingency fee over the term of $107,723,723. Such agreement to be terminated by both parties in 30 days without cause. Thank you.
That was in. It was. I'm sorry. That was.
Should I reread it off the slide?
The one about Array or?
Please read the one about Array.
Okay. We'll take it from the top. Okay, I'll read the Array. Authorizing New York City Health and Hospitals Corporation, the system, to further increase the funding by $1,960,238 for its previously executed contract with Array Architects for architectural/engineering services for the renovation of space at New York City Health and Hospitals Bellevue Hospital and New York City Health and Hospitals Woodhall in connection with the System Correctional Health Services Initiative to treat patients who require higher levels of care in its outposted therapeutic housing units, which follows previous funding increase of $1,814,888 authorized in November 2021 and $6,409,289 in November of 2022, such that the current funding increase from $16,887,169 to $18,847,407 is to cover the design cost at Bellevue only.
Go ahead. Good job, Manny.
Oscar,
Thank you very
you may
much.
take over the rest.
I will do my best.
Thank you.
So I'm going to go over the proposed amendments for Bellevue only. I'm going to just stick to the script here. So justification, new requirements for security operations resulted in a pause in work and the need to modify existing design and construction scope for the second floor recreational area at Bellevue H Building, visitation areas, staff support and administrative areas, and patient spaces. In addition to that, we also encountered a lot of field conditions. Increase in funding allocation to keep administrative and support staff for modification to existing scope, and increases in allocation are still within the total project budget allocated by OMB. There are still some potential amendments that may follow, so we will potentially come back to the board for additional approvals. Next slide shows you the current state of where we are with the increased allocation of funding and where we are with the CP statuses. So specifically for Array, we're asking for an increase of $1 million. I'm just going to round it off. Funding allocation of increase of $2 million. Currently, we have $188,000 that was previously approved within their original contingency, and we currently have a CP pending OMB approval for $1.7 million. For ACOM, we are asking for an increased allocation of $1.5 million, and the CP is already approved for the $1.5 million. And for Consigli, we're asking for an increased allocation of $19.6 million, and we're also asking for a contract extension from March this year that has expired already to December 31st, 2023. The $6 million was previously approved within their contingency. And there's two parts to the CP, one for 1.4 million and another for 12.6 million that's pending OMB approval. All those totals add up to the 19.6 million. The next slide shows the team and how it's structured. So New York City Health and Hospitals, OFD, and CHS, Correctional Health Services. We contracted individually with all parties. So specifically, ACOM oversees the entire program, both at Bellevue and at Woodhull. Then we have Array, the design consultants, doing the design at both locations. Each one of those consultants has just one contract with 2 locations to design. But this request here for the amendment today is only for the changes at Bellevue only. And then you have the third party here, Consigli. They are our CM builder. They only have one contract for one location, and that's for Bellevue only. So background, Outpost Therapeutic Housing Units, OTXHU, was publicly announced in November 26, 2019. The board approved the contract for Array for design services both at Bellevue and Woodhull back in June 2020 with a not to exceed of 8.6 million. In November 21st, we had an increased NTE of 10.5 million. And then we came back again on November 2022 for an increased NTE, bringing it up to 16.9 million. The contract term is good for 5 years and is scheduled to end in November 2025. The board also approved ACOM, the program manager, at both locations, Bellevue and Woodhull. Similar dates, June 2020, not to exceed of $9 million. We came back to the board, got additional approval in November 2021 with an increase to 15.1 million. And their term is also $5 million, which is expected to end at the end of 2025. And last but not least, Consigli, the CM builder, their contract was approved on November 2021 with a not to exceed value of 121 million. As of May 2022, we locked in the scope and increased their not to exceed to 140 million. And as I mentioned earlier, the contract term is ended on March 2023, and we are requesting to extend it to the end of 2023. The next slide shows the utilization plan. Array's utilization plan was 32%. To date, they have achieved 50.64% to date. That's payments made. ACOM had a target of 34%, and we've achieved 36%. And for Consigli, they had their target at 31%, and they have achieved 37%. And the last slide is the official request. The Office of Facilities Development and Correctional Health Services is seeking approval for the following contract amendments at Bellevue, OTXHU, Outpost Therapeutic Housing Units for Arrays, increase not to exceed by 1,960,238, increase in the total contract not to exceed from $16,887,169 to $18,847,407. And ACOM, increase not to exceed by $1,498,738, increase in total contract not to exceed from $15,136,567 to $16,635,305. And Consigli's increase not to exceed by $19,629,719, increase in total contract not to exceed from $140,339,695 to $159,969,414, and approved contract expiration change from March 31st, 2023 to December 31st, 2023. And we'll take any questions.
Every time this comes back, I get so agitated. It's not just more money, which is bad enough, and I know it's OMB funding, it's the city funding it, but it's the incremental time. And when you say new requirements for security operations, is that the state again? Or is that
That's the Department of Corrections.
the State Department? City
Department. So
I see.
I think essentially what happened is that we designed it collaboratively with the prior correctional administration. They signed off. It went to the state signed off.
Right.
New corrections administration felt that the facility didn't meet the requirements and had different requirements. So we are now meeting those requirements so that we can open the facility.
And it says, due to regulatory agency requirements, is that the city again, that there may be?
It's the interpretation of the requirements that's the issue. The previous administration saw the requirements one way, and the new administration sees the requirements a different way. So we are addressing those requirements both in design and in construction. We've actually built out certain areas, and we actually now have to unbuild to rebuild to meet those requirements.
It's unfortunate.
What's pending will be, once the city Department of Correction final requests are incorporated in a design, a revised design, that will go back to the state, as Dr. Katz noted, had happened earlier. And once the state, the regulatory agency, reviews the new design, it may or may not come back with more feedback. We are hoping not.
And OMB still has to approve, I guess I saw a note.
You want to clarify?
Yeah, OMB is basically checking for capital eligibility, which is usually significant, comprehensive, contiguous type work, which this meets.
It meets. Okay. Thank you.
It's still within the allocation
Yeah,
now.
the full budget it's been allocated by OMB already, and it's within, even these changes are within the budget allocated. There's not new money that we're asking for.
Okay, any questions? Okay, so let me ask for a vote then. I'll go one by one. I'll start with, I'll go through the agenda. So Consigli first, Dr. Katz.
Yes.
Sara Hernandez Piñero.
Yes. A reluctant yes.
Jose Pagan, yes. On ACOM, okay.
Yes.
Sara Hernandez Piñero.
Yes.
And Jose Pagan, yes. And on Array, Dr. Katz.
Yes.
Sara Hernandez Piñero.
Yes.
And Jose Pagan, yes. Thank you so much.
Thank you.
Well, this is it, right? So,
We'll see.
so let's move to the next one. Precise.
This is an approval to enter contract with Nalco Water Services. The resolution is authorizing New York City Health and Hospitals Corporation to enter into a contract with Nalco to provide water management services and maintenance services of secondary disinfection systems across the term of 3 years, with the system holding 2 one-year renewal options for a base contract amount of $10,300,095, including a 20% contingency of $2,079,000 for not to exceed amount of $12,474,000. Some of the background: due to the 2015 Legionella outbreak, New York City state and regulations were issued regarding water management. New York City Health and Hospitals obtained services of water management consultant to register and document maintenance of New York City Health and Hospital water cooling towers. New York State Department of Health for acute hospitals, as well as our post-acute facilities in New York State, to perform an environmental assessment. This including preparing and implementing a sampling and management plan for portable water systems to test for Legionella. This also included institutionalizing control measures in the event of a Legionella exceedance. New York City Health and Hospitals currently has a water management contract with Nalco that has a 3-year term. It began in April of 2020 and expires in June of 2023. The contract is available through the Premier GPO and was transitioned from JCI in 2016, for which there was no MWBE spend goal at the time. The total spend over the last 5 years for water management services has been $313,040,417, $11,790,000 approximately for water management services, and $1,250,000 for maintenance of secondary disinfection systems. Some of the RFP criteria included 5 years of experience in water treatment consulting and healthcare, MWBE utilization, annual revenue of greater than $2 million, local offices and staff based in New York City. Additional criteria included 30% cost, 30% methodology, 25% experience, and 15% MWBE. The evaluation committee was made up of all of our current operators at each of our facilities to help evaluate this organization. Overview of the procurement in January 17, 2023, RFP posted in City Record. January 31st, 2023, pre-proposed conference was held. 5 vendors attended. In February 16th, proposal deadline, 2 proposals were received. March 20th, vendors presented proposal solution to evaluation committee. Evaluation committee debriefed on proposals. And on March 21st, scoring was finalized. Due to the very close scoring, there was a hand vote taken on the scoring at the end, and Nalco was the suggested winner. Here is a vendor performance, and they resulted as good. Part of the support and part of the recommendation that we were getting from our facilities team is that we wanted Nalco to expand the coverage of their region, which is why I suspect this was good and not excellent. So Nalco has performed all services required to date with no issues. However, the feedback we did get from our staff is that Nalco needed to add a second resources to help split the coverage in the city. Contract budget. So from years 24 through 28, we're looking for a contract of $9,375,000 to maintain our Enbridge systems of $1,020,000 for a total of $10,395,000 with a 20% contingency that'll bring us to a grand total of $12,474,000. Projected savings as a result of dealing with the contract directly and not through a GPO. We've projected savings on our 5-year spend as well as our maintenance area for a total of $2,645,417. MWBE utilization. Nalco's utilization plans includes AMC Services. Nalco has been working with AMC Services and at New York City Health and Hospitals facilities to serve ice machines, and anticipated 25% of the overall contract will go to the scope. AMC Services is not yet a certified WBE vendor. However, Nalco proactively has asked AMC Services to begin the certification process. AMC Services expects to receive CT State WBE certification shortly, which will expedite the New York State process. Additionally, the vendor diversity team has facilitated a connection with NYC SBS to begin the MWBE application process there as well, with request to expedite review. Thanks to Keith Talby and his team for that. Should AMC Services not become a certified vendor within a year of the contract award, Nalco has agreed to subcontract services to a certified MWBE to at least meet the 5% assigned goal. And then finally, a review of the capital committee request. Thank you. I'll take any questions.
Any questions?
Oh, very quick question. The ice machine cost went from 5% to 25%. Did you just have more ice machines?
The MWBE utilization plan is to use this service for all of the ice machines. So yes, initially it is an increase in ice machine services, but not the number of ice machines, just their coverage of them.
Then let me ask for a vote. Dr. Katz,
Yes.
Sally Hernandez Pinheiro, and Jose Paganias. Thank you, Manny.
Thank you.
So the last presentation. Kira, you want to read the resolutions into the record?
Sure. Good morning. I'm here to present the authorization for 3 different license agreements for retail food operations. First, authorization, authorizing the New York City Health and Hospitals Corporation, the system, to sign 5-year license agreements with Everytable PBC for its use and occupancy of space in each of 3 system facilities for retail food operations, with each agreement to be terminable by both parties on 30 days notice without cause, as follows. Approximately 415 square feet at New York City Health and Hospitals Metropolitan at an initial rate of $50 a square foot or $20,000 per year, to increase by 2% per year for a total occupancy fee over the term of $107,723.63. Approximately 1,000 square feet at New York City Health and Hospitals at Jacoby at an initial rate of $25 a square foot or $25,000 per year, to increase by 2% per year for a total occupancy fee over the term of $130,101, and approximately 381 square feet at New York City Health and Hospital South Brooklyn Health at an initial rate of $28 a square foot or $10,668 per year to increase by 2% per year for a total occupancy fee over the term of $55,516.70. Next slide, please. I'm here with representatives from Jacobi Hospital and Metropolitan Hospital as well, but I'll work through the presentation. If there are further questions, we can answer them. A little bit of background on food vendors at H&H facilities. It's difficult to find food options near our facilities because oftentimes they're not near retail corridors. Facilities would like 24/7 access to food, want healthy options for food, and want reasonable cost-conscious pricing for visitors. So it's really important to have all these needs met when selecting a food vendor. COVID caused several food service vendors to close within the system, leaving many hospitals without food service or with old operations in need of updating. Metropolitan, South Brooklyn, and Jacobi all are in untenable situations. Jacobi is losing their current food service vendor this year. Metropolitan has no food service vendor. And South Brooklyn needs a vendor for their new tower. Next slide. The selection process. Each facility independently selects the vendors that suit their patient and staff needs, taking into consideration, as I mentioned before, healthy menu, culturally sensitive foods, pricing and tastings, and 24/7 operations, 365 days a year. 3 hospitals did diligently search for the best candidate to provide food services, including presentations and sampling of food offerings. Metropolitan had attempted to bring in 2 local companies, but that failed to materialize. Jacobi considered 3 other vendors. After considering the other vendors, 3 facilities chose Every Table due to their ability to have 24/7 operations and offer low prices. Under the system rules, real estate space license agreements, such as this, are not required to have an RFP. That's why I'm presenting it. Seems a little not atypical, so because this is a license agreement. So let's just quickly go over each of the, let's talk about Every Table. I apologize. Every Table is a public benefit corporation with operations in Los Angeles and New York City. It grew out of a nonprofit organization focusing on healthy food and food-related health problems. Their mission is to transform the food system to make fresh, nutritious food accessible to everyone and everywhere. They have 8 stores in New York City. They operate a central prep kitchen in Brooklyn, which guarantees daily the delivery of fresh food. They plan to operate 24/7, 365 days at the 3 facilities. Each of the facilities will offer the same menu, which has been vetted. As you can see from the pricing, which I won't read, the low end is $1.50. The high end is $8.45. Average price $4.50. That is a very reasonable meal in New York City. Next slide, please. So we'll quickly just run through each of the facilities and the space needs and the pricing, et cetera. Jacobi Hospital is the largest of the 3, and they have 5,500 staff, patients, and visitors daily. As mentioned earlier, they only have 1 food vendor, and that food vendor may discontinue operations in the near future. Jacobi has requested the food service vendor to be on the first floor of building 1 at 1,000 square feet. Every Table will construct the new space and provide all the equipment. The rent to be $25 per square foot for 5 years, increasing 2% per year. Agreement can be terminated within 30 days, and all the price increases above CPI must be approved by facility. Next slide, please. Similarly, Metropolitan has 3,000 staff, patients, and visitors daily, has no food vendor since 2020, despite all their efforts. They've selected a location also on the first floor in the main building. And again, the vendor will construct the space and provide the equipment. The rent there is $50 a square foot, and same terms apply. Next slide, please. And for South Brooklyn Health, 4,000 staff, patients, and there is no food vendor in the new building. The CEO has requested they occupy 381 square feet in the tower building. And again, the vendor will construct new space and sign a license agreement for 5 years with 2% escalation each year. And that basically concludes the presentation.
Thank you so much. Any questions?
When will they be up and running?
Hopefully tomorrow. No, I'm just kidding.
As soon as we can. We have to go through this board process. We have to finish the legal agreements. They have to construct their space.
A year, 2 years?
Oh, I don't think it's going to. They'll be up and running expeditiously. I'm sure within 8 to 10 weeks. But we need to finish our approval processes and sign the legal agreement. So
Jacoby, is the company not operating in New York, or did they just not want to continue with Jacoby?
Great question. So it's currently Aubon, which is transitioning to Panera. So we chose not to go with the Panera brand. We did ask Aubon Paint if they would like to put in those. They were one of the 3 vendors that actually submitted it, but they came in at a higher pricing point than Every Table and do not provide the healthy food options as does Every Table.
Yeah. And Every Table just has 8 stores. It has 8 stores in New York.
mhm.
Yeah, because I think the important thing is to have a vendor. I mean, it's great if you can get the best price and cultural diversity and everything like that, but to go without some kind of vendor for many years just doesn't make any sense.
Yeah, I think we are balancing like a scale. We have operational needs, we have healthy food needs, and we have pricing needs. And I know that my colleagues at the facilities did their taste testing, went to the central kitchens they prepare, and felt really confident that this vendor will deliver quality, healthy food at a reasonable price and be there in the times they need people to be there for staff and visitors. And so that's what we're here today.
Thank you. Any
No,
questions?
I mean, this has been an issue throughout our system. You can imagine, because we want food available at times when there's not large volumes for business. It's not so easy to arrange, right? It's a tough niche, and we've had places open and close. It's been hard to maintain catering services for our patients and our staff. But as you say, it's awful. You're working a long shift and there's no food,
Right.
right? So we have to do our best.
So let me then ask for a vote for Every Table South Brooklyn, Dr. Katz.
Yes.
Sally Hernandez Piñero.
Yes.
Jose Pagan, yes. For Every Table in Metropolitan.
Yes.
Sally.
Calda Mesa and Metropolitan.
Jose Pagan, yes. And for Every Table at Jacoby, Dr. Katz.
Yes.
Sally Hernandez Piñero and Jose Pagan, yes. So thank you so much. Resolution is approved.
Thank you.
So next on the agenda is the Vice President's report. Mr. Saez.
Manny?
Manny. The report.
Yes. So once again, good morning. The Office of Facilities Development has updates on several key initiatives. After the fire in Metropolitan last month, we were able to shift to emergency power generation has been completed for the first phase of the work and now back to full utility power. There is additional work to be done to improve infrastructure, but I am proud of our team for solving the first hurdle quickly and efficiently without major interruption to clinical services. We continue to diligently prepare for our triannual surveys and celebrate the successful completion of surveys at Elmhurst, Woodhull, and Queens. Regulatory sign-offs are currently being completed at the Ruth Bader Ginsburg at South Brooklyn, and we are awaiting final opening date, which we now have, and this has occurred over this weekend. So this is a pulse report, but now up to date. We are currently completed a number of facility projects, roof replacements at Woodhull, South Brooklyn, Elmhurst, Queens, Jacoby, Lincoln, Metropolitan, and Harlem. Underground tank replacement at Lincoln and Elmhurst, and elevator resiliency upgrades at Bellevue. Neponset major demolition will be complete before the beach season, leaving only the grading and planting in the summer and fall respectively. And this month we have the number of resolutions that we presented to you today.
Manny, any questions from board members?
No questions for me.
Thank you so much for all the work you do. You've been busy, and we appreciate that.
Breathe.
And
Have a wonderful day.
Manny's been doing a great job.
Thank you very much.
Thank you.
Have a good day.
So any old or new business to come before the committee? So hearing none, then the meeting is adjourned. Thank you so much.